Good morning, everyone. Welcome back to Atlanta and Company. I'm Christine Pilara. Reproductive Biology Associates was established over 30 years ago as Georgia's first IVF treatment center, and it specializes in helping bring new life into this world. Joining us today to talk about an issue that many couples face is Dr. Dorothy Mitchell-Leef. Doctor, good morning to you. And I know you always, it's always so good talking to you because these are things that people are experiencing, and we don't always talk about it when we're going through it. So it's so nice to have RBA on the show to talk about these issues. And today we're discussing multiple losses. So what are the reasons that people might suffer multiple losses?
Well, there can be many. Sometimes it's simple as a hormone imbalance, such as progesterone deficiency. Other things can be structural, such as a uterine septum, where there might be a wall in the middle of the uterus, and the embryos don't implant, and then they miscarry because there's no blood supply. We can also have problems with clotting factors. And another large one that we see in ladies over 35 to 40 is genetic abnormalities or pregnancy loss due to that.
Okay, so what you're saying is these are people, these are women who are able to get pregnant, but they're not able to hold on to the pregnancies because of these varied reasons.
Correct.
Okay, so when should a couple decide, how long should they be going through something like this before they say, okay, we need to seek some counseling or treatment?
Well, I think, you know, in the past, we always say 3 pregnancy losses. However, the problem is, as you get past 35, you have a combination of issues such as genetics. So we tell people, some ladies obviously don't, no one likes to have pregnancy loss. And I think that many times ladies might even come, or couples will come after the first or second loss just to see what's happening, get some basic tests, and then they can decide if they want to do anything else that might be more extensive. But I do believe that more women and gentlemen today are coming in early to say, what can we do and what might be the problem.
Right, because as we were discussing in the commercial break, when you do have a loss, then it seems like you can't try again for several months, and then it might take several more months. So the sooner you know and the sooner they can evaluate what is truly wrong, the better. You know?
Right.
And speaking of that, what tests do you actually use, or how do you go about evaluating the reasons?
Well, some of them will be just blood tests that are easy. The one that's very important is called a hysterosalpingogram. It's a dye test, X-ray. They'll be able to show us if the shape of the uterus is fine, is there a septum or another type of problem, scar tissue maybe from other D&Cs. That needs to be done. If they do the basic tests and we still need to work some other things up, we can do clotting factors. It's called thrombophilia workup. That's where some people may have inheritable clotting factors that may cause problems with clots not allowing the pregnancy to continue or causing problems once you do get pregnant. And the third, the last one is genetics. It's for those women who might have had losses in the past that do show genetic abnormalities. Division of the egg wasn't correct, and we can find out whether or not later on, that's a test later that we do, but mainly the other tests are the first ones we go through.
Sure, and then how about treatment for that? Once you diagnose what the problem is, and how do you go about treating, or what are the different treatment options?
Right, the simplest is, say you had progesterone deficiency, you can add that 4 days after ovulation. The hysterosalpingogram, if there's some problems, they can have a septum removed. That's very done easily in outpatient surgery. We'll remove that. It might take a few months to build back the tissue, but that can be done, or remove scar tissue if needed. If there are problems with the clotting factors, then we can give people blood thinners such as heparin or Lovenox, and you take that after a few days after you've tried to get pregnant, and you stay on that for months depending on what the problem might be. And then the last, if you have done everything else and we can't figure anything else out, then we usually recommend doing in vitro, where we can actually biopsy embryos that are day 5, called blastocysts. We can take a few cells out, freeze the embryos, and send them off and do all 23 chromosomes.
Wow.
And we can know which ones are normal, and that really is very helpful, especially in patients that the older they get, the less time they have, and we're really trying to move on and be able to help them have a good pregnancy.
Right. And are most couples able to conceive after they have these treatments?
Yes, the majority have. I mean, there's always that 1 or 2% we're not able to help no matter what we do, and those may need surrogates, but that's very low number compared to everything else. So we're doing very well in being able to help people achieve a good pregnancy, healthy pregnancy after that.
And I imagine, having been in the business for over 30 years now, in the business of helping people, you know, achieve the families they want, I imagine you've seen the number skewing later and later for women who are having these professional careers, or like myself, my first marriage at 36, trying to get pregnant at 37, 38, and suddenly, you know, you have some problems that you're contending with as being an advanced maternal age, as I kept hearing over and over and over. Yeah.
You know, our average age is about 38
Is it?
for our
Okay.
patients in
For your
general.
patients,
Yeah,
got it.
but we're trying to get more women to come in earlier, to think about getting tested earlier so that they don't have those issues and then we're not able to help them.
Sure.
And for those who may be putting all this off, just as another aside, we do egg freezing for those
Good.
ladies who unfortunately have not met Mr. Right yet.
Right.
And we're hoping that they'll be able to have children later. But I think that just getting people in early, thinking about it and not waiting so long is truly going to be helping them be able to have that baby they want so much.
Good. And last quick question, insurance, what does it cover? Diagnostic testing, treatments? It depends.
For the most part, they will pay for it. The only issues we've had is that the clotting factors many times will not be paid for unless you have 3 losses, which is a bit sad,
Right.
especially the older you get, because then I have to wait for that
Oh,
to happen. The last one, the in vitro with a genetic testing, is usually not covered. Some insurance covers the IVF part, but they may not cover the genetic testing.
Got
So
it.
unfortunately, it's not for covering everybody.
Got it.
I wish I could say it was.
I know. But thank you so much. You do
You're
such
very welcome.
great work over there, you and all the doctors, so we appreciate your time. Thank you. And if you would like more information about Reproductive Biology Associates, please give them a call. It's 404-257-1900, or visit their website, which is rba-online.com. And this segment was paid for by Reproductive Biology Associates. Thanks again, Doctor.
Thank you.